Welcome to week 6 of our menopause series. Today I will be talking about perimenopausal and menopausal acne, an issue that many of you unfortunately can relate to. I see menopausal acne in my female patients every single day, and the consultation always begins with the same frustrated questions from my patients. Doc, why do I have acne at my age? I thought I would be done with this after my teen years. I feel like I'm the only woman my age who has pimples on their face. And now I have to fight wrinkles and acne at the same time. And my response is always the same. You are not alone. In fact, a 2006 survey of American women reported acne prevalence of 26.3% of women in their 40s and 15.3% of women in the 50s or older. Numbers that most women, I bet you, would never suspect. So why does it happen? The cause of menopausal acne is multifactorial, with hormonal imbalance being the major culprit. With perimenopause and menopause, there is a decrease in estrogen and progesterone, which causes a relative increase in androgens such as testosterone. This doesn't mean that menopausal women have abnormal hormones that need to be checked. It simply means that in comparison to premenopause, they have a relatively higher percentage of androgens like testosterone. And this then leads to what's called hyperandrogenism, and this manifests as acne, hirsutism, which is basically increased hair growth in abnormal places like the chin, and androgenetic alopecia, or female pattern hair loss. Genetic factors, stress, dietary changes, lack of sleep and exercise, and other lifestyle changes are also implicated as trigger factors, which can make matters worse. Although menopausal acne can present anywhere on the face or body, the predominant presentation is that of cysts, pimples, and blackheads in the chin, jawline, and neck area. In fact, I call this the hormonal triangle. And these breakouts often lead to dark marks and scars that can be hard to treat. And these cosmetically disfiguring changes often lead to depression, negative influence on the quality of life for my patients, especially since many of them thought they were done with acne after their teen years. So in terms of treatment, spironolactone is the gold standard and my go-to for perimenopausal and menopausal acne. Spironolactone is an anti-androgen medication that blocks one of the enzymes and receptors in the body. It is incredibly effective in my patients within the first 1 to 3 months for most, and wider studies show that 85% of participants report greatly improved acne by 6 months. And the great thing is that normally spironolactone has very few side effects at doses given for acne, which are low. 25, 50, or 100 milligrams. Some side effects can include a little bit of increased pee in the beginning because there is a diuretic potential, some menstrual irregularity, but it's very rare, and most of these side effects, if any, go away within the first 1 to 2 months of treatment. So therefore, I've had patients on it for years without any issues. Other treatments I use for menopausal acne include low-dose antibiotics for a period and topical medications. However, oral contraceptives or birth control are contraindicated in most menopausal women because increased age can lead to make them more susceptible to dangerous side effects such as blood clots. Finally, I almost always recommend in-office procedures as a mainstay of my treatment of perimenopausal and menopausal acne in my patients. Lasers, chemical peels, and other treatments can kill two birds, both by helping the acne itself and the acne scars that have come with it. And also through, of course, their anti-aging effects. So you get the double benefit. So if you're suffering from menopausal acne, know that you are not alone and that effective treatment is available.